Hello, my name is Eisenhauer. I'm the Director for Gynecologic Oncology here at the University of Cincinnati Medical Center. And this is the first in a series of regular updates regarding gynecologic cancer therapies. I'd like to take the opportunity today to discuss the subject of cancer clinical trials, both from the standpoint of advances that these provide for our patients, as well as to dispel some of the myths regarding cancer trial therapies. It's important to understand that clinical trials, although evaluating experimental therapy, are not experimenting with therapy. The majority of the cancer clinical trials that we have open pair either new or novel treatments with established therapy regimens, or are looking for truly novel therapies where no therapy exists. The unfortunate reality is that current cancer therapies are not ideal. They involve a lot of side effects and in many cases are not responsible for the types of cures that we would like for our patients. Clinical trials are the way in cancer research that we determine which therapies are better than the current ones we have to offer and allow us to achieve better outcomes for our patients over time. The main benefits to patients participating in clinical trials involve therapies which may not otherwise be available through commercial means or through other providers, and also allow very structured follow-up, both for the side effects that these cancer therapies can entail, as well as additional ways to track their cancer over time. The goal of cancer research is to provide better cancer therapy every year than we had the year before. And without dedicated research to explore new therapies, we're stuck in a paradigm where the current therapies that we have available are the only ones that we have to use. Currently in gynecologic oncology, we have many trials open for different types of gynecologic cancer. We have 10 trials currently for patients with ovarian cancer, 3 trials currently for patients with uterine cancer, and 4 trials currently for patients with cervical cancer. Each of these trials has different criteria that they use to include patients on the trial. In some cases, the trials are open to patients who have a new diagnosis of cancer, and some trials are open for patients who may have had cancer for a while, and that cancer has returned or recurred. And these trial therapies are new ways to try to treat these conditions. In gynecologic cancer, organized clinical trials have been available to our patients for the last 30 or 40 years. And over the course of that time, these trials have been responsible for establishing new standards of care and improving survival. The number of patients, particularly with ovarian cancer, cervical cancer, and uterine cancer, have a very different outcome in 2014 than they did 10 years ago. The therapies that we have used to achieve these ends are ones that were discovered through clinical trials, and it's by the participation of those patients on those trials that we're able to offer better therapy today than we